Doctor, what is the latest situation in North Lincolnshire? Very busy time for doctors and hospitals at the moment.
Absolutely, Peter. There's an immense amount of pressure both on hospital and out of hospital services. So, you already know there have been critical incidents with hospitals, but even in primary care, general practice, a lot of our staff members have got issues with isolation due to COVID, and that's affecting workforce.
I mean, the infection rates for North Lincolnshire are 3 times higher than they were before Christmas, and the PM has said within the last hour or so that there will be no further restrictions. Do you think that's the right path to go down?
Well, I'm a medical person, Peter, so from my medical point of view, I want to have the best chance to look after people. And I think in my personal view, when the numbers are that high, when the staffing levels are so low, more stricter restrictions would be a welcome change to help the national health system.
So you would say that the PM tonight has got it wrong, holding his nerve is the wrong thing to do, and there should be more?
I think feeling on the ground is such, Peter, that we cannot keep looking after people when we are understaffed, and that increases risk levels. So we do need something. I mean, the numbers, 220,000 new cases today, increasing hospital admissions. We definitely need more stricter actions.
So if you're saying that as a medical expert, many of your contemporaries will be, why is the Prime Minister not going down that path?
Again, hard for me to tell, Peter, because it's something which, I don't have the exact facts which the Prime Minister has given. I can only go with what's happening in our local health system. This week alone, one of our practices had less than 20%, more than 20% staff isolating due to COVID test results pending and things. No service can work like that.
But that number is phenomenal. So how do you actually cope? How do you actually provide a service with that number of people off?
Well, that's what's happening, that people who are at the sort of surgeries and practice level, they are having to do extra work, they're having to do extra sort of longer hours or sessions. The workload, the number of blood results, for example, or hospital letters we're going through is a lot.
Well, you've made your point there. So just to clarify, you would say the Prime Minister has made a mistake tonight by not introducing further restrictions?
In my medical view, yes, I would have welcomed a stricter restriction. Very
interesting indeed. Doctor, very good to have you on the programme tonight. Thank you very much indeed. Wish you well.
Thank you.